Hey guys, my name is Haley. Today we're doing a podcast, and today I have my group members with me.
I'm Brianna Johnson.
I'm Jess Charmack.
And I'm Carrington Pfeiffer.
So, right now we're tackling adolescent obesity.
Carrington, what defines an adolescent?
So, an adolescent is an individual aged 10 to 19. Adolescence is very vital for growth and development, making it a risk period for obesity.
Oh, to tell you more about this public health project that we're doing, we wanted to do a public health intervention based around information and putting health back into people's hands and really letting them take the reins with their own bodies. And when you're an adolescent is when you move into college, and that's a really big key moment in your life, which most of us have been through that phase, which is why we wanted to focus on that today. We looked around campus and noticed that the healthiest things that we have to offer on campus here are a little bit out of reach. They're a little bit overpriced, and then the health sections in our dining hall, if you have a pass there, people often skip over that. We did a little bit of research surrounding the Child and Adult Care Food Program and the Healthy Hunger-Free Kids Act. And we noticed during our research that a lot of these health interventions are based around children. And we understand that that's because as adults you can't really control what anyone's eating, especially when they're not in school anymore. So we wanted to kind of discuss with some people in our community about what can we do for freshmen mainly, what can we do for the adolescents to let them take control of their health. So Carrington's going to tell you about our community health partners and the questions that we had for them.
So our first community partner is Dr. Marissa Malcarone. She's a professor here at UTC and holds a registered dietitian, nutritionist, and certified in public health credentials. So the first question we asked her what is the biggest contributor to obesity in college-age adults? She responded by saying a significant contributor to obesity in college-age adults is often a combination of poor food choices and limited access to nutritionist options. Many students face time constraints, stress, and financial limitations, which can lead to relying on fast food, processed snacks, and sugary drinks. Additionally, the availability of these unhealthy foods on or near campus, along with a lack of nutrition and culinary literacy, can contribute to weight gain. Social pressures such as participating in late-night eating or drinking also play a role. Also, limited opportunities for physical activity due to busy schedules can compound the problem. The second question we had were what community partners are there in Chattanooga addressing obesity? Malcarone said, one key community partner here on UTC's campus is Scrappy's Pantry and Market. This initiative provides students, faculty, and staff with access to free and low-cost nutritious food. Scrappy's Pantry offers fresh produce, non-perishable items, and even cooking supplies to help those in need maintain a balanced diet. By increasing access to healthy foods on campus, Scrappy's Pantry and Market helps reduce food and nutrition insecurity, which is often linked to poor nutrition and obesity.
And I know that this is something, too, that the campus is involved in. I've personally visited the Scrappy's Pantry, but I've also contributed. I know my sorority does food drives for them, where we do non-perishables, sometimes fresh food. And it's a really, really cool thing to be able to go and, as a college freshman, just to go get an apple for once, because that's not something that you generally buy for yourself because it doesn't last very long. So when it's free, it's encouraging students more to eat healthy foods.
The next question we asked is, what's the biggest piece of advice for college-age adults to combat obesity? Malcarone responded by saying, a piece of advice would be to focus on consistency, balance, and planning ahead. Take small steps toward incorporating more whole foods like fruits, vegetables, lean proteins, and fiber-rich foods, example, whole grains, into your diet, and reduce reliance on processed food. Meal planning and prepping can help students avoid last-minute unhealthy food choices. It's also important to learn about portion control and be mindful of your eating habits. Regular physical activity is essential, whether it's going for a walk, joining a fitness class, or participating in campus intramurals. Lastly, don't underestimate the power of sleep and stress management, as both play significant roles in maintaining a healthy weight.
The awesome thing about UTC is that it's very easy to work out. You can even get a job at the gym, which is free to all students, which is a really cool way to be paid and then be able to incorporate fitness into your routine. We also have free workout classes, which is a really amazing thing that I know is very unique for this school. I think another thing that students might need to hear about is affordable grocery stores that offer organic options like Aldi's. I think a lot of students kind of just think first thoughts are Walmart, and they go in there and they go immediately to what says 98 cents. But the cool thing about Aldi's is it might be a little bit of a further drive, but you can get those healthy foods for less than $1, and it's a really, really great option.
The last question we asked Dr. Malcarone was key to avoiding the freshman 15. Everybody dreads that. I know I caught it, so.
Yep, it's the only thing you hear about as a freshman going in.
Yeah. So she answered by saying, developing a routine that includes healthy eating, regular exercise, and making mindful choices in a social environment can help support healthy weight maintenance. College life can be overwhelming, so it's important to establish a balanced eating pattern early on. This means making time for regular meals, including nutritious snacks, and staying hydrated. Additionally, staying active, whether through walking around campus using the University Fitness Center or participating in recreational activities, can make a big difference. It's also helpful to be conscious of drinking habits. Alcohol can make a big difference. This is what we talked about in my psychology class. It mainly comes from alcohol and sleeping too much. So alcohol can make a big difference. It's also helpful to be conscious of, and how they contribute to weight gain, drinking habits. Building a support system like finding a workout buddy or joining health-conscious students' organizations can make healthy habits more sustainable and enjoyable.
I, for one, definitely agree that alcohol is the biggest issue when it comes to the freshman 15, but I also think as a student who also works 20 hours a week plus, the main thing, too, that really comes in the way of these, we're hearing Dr. Malcarone saying just have a routine. If you have a routine, you can avoid most of these issues. But when you have classes that might be different every semester, different every week, and then you're working, and then you're coming back, and the dining hall's closed, you're kind of stuck in a way.
Right.
I've definitely found myself in that situation. And there's definitely ways around it, but I think when you're a freshman, you're just trying to get through the year, and it's probably not your first thought. And so I think it's really important if you're a freshman and you're worried about your health, or maybe you should be worried about your health, to really take these into account and just maybe plan out before work what you're going to eat after, or have something ready. I know that Crossroads offers to-go boxes, and they'll let you bring those for free and get food before, so then you can have a healthy meal after work, even if it's at 11 o'clock at night when we get home.
It definitely hit, especially with my dorm not having a kitchen, and then downstairs in my dorm is 2 restaurants with fried foods, and I have a good meal plan, so I can just walk to Chick-fil-A. So
and Chick-fil-A is the only thing ever open too.
Yeah.
Well, Josie's going to tell us about our next community health partner.
Okay, so we did reach out to a registered nurse, Miss Johnson. We asked her a few questions as well. The first one being, how do you feel the freshmen's classes' diets are affected during the transition from eating from home cooked meals to eating on campus only? She said that home training, education, and discipline affects the outcomes of this answer. The transition to cafeteria dependency doesn't have to be unhealthy. Cafeterias serve versions of home-cooked meals. Students often do not make time to eat healthy and often pick some comfort food fast foods that the campus also offers. This is what causes the known saying freshman 15. This is no fault of the school. Campus-only eating is beneficial to the student making the choices that sway the outcome.
It depends on what you grew up around. If you grew up around a family that's constantly eating fast food, this might not be much of a transition for you. But if you come from a family that fast food's a luxury, you're always eating at home, then this is going to be a really big change for you. And so those foods might affect you a little bit more than someone who is used to eating at this rate.
I know that is for me. I didn't bring my car this year, but I'm like used to eating out pretty often with my family, so it's kind of balanced. But I guess it kind of helps because DoorDash is expensive, and I was not.
Yes, DoorDash is so expensive.
Okay, so Ms. Johnson works in the oncology field, so we asked her, in your position at work, do you feel that diets affect the outcomes of your patients? And she responded with, nutrition is where oncology care begins. It is one of the most single important aspects of patient treatment and outcomes.
Wow.
Additionally, we asked her, do you feel healthier eating options are obtainable and that these students may be ignoring them? And she said, as mentioned in my above answer, the campus cafeteria offers healthy many options. The poor choices are that of the student.
Right.
The last question was, do you believe that the common diet of fast food is affecting the mind of freshmen when it comes to completing classwork? She said, nutrition is crucial to our body's performance. Fast food offers blank calories without nutritional value, causing obesity, and diabetes. Proper nutrition leads to better outcomes for students both physically and mentally. A healthy body supports a healthy mind.
I know as a group we talked about what we would do next if we were able to take this out into the community and really start working at this. And we said, starting with campus, we would probably start looking at how many vending machines we have. We would probably start looking at if we could lower the prices of the healthy options in the dining hall or not in the dining hall, in the food court. If we could maybe replace one of our food court options with a permanent healthier option, maybe with wraps or something. And I think it's important to consider all these things because we do have Freshens on campus, but Freshens is a little bit out of the way. They're closed. They're open at weird hours, so they're closed a lot. And I think people just kind of forget about them unless they're in that hall. So I know people are in the food court every day, no matter what grade they're in or what year they are. And so I think maybe implementing a healthier option in the food court where we know that we could go in there and use our dining dollars would be a great first step. So what do y'all think that we could implement on campus?
Yeah, definitely implementing a restaurant that could promote healthy eating and also lower prices that are affordable for college students. Also having the hours be reasonable for students.
I think there should be also, like you said, more promotion. I see on the Mox Dining Instagram, they do a lot of promotion, and I think themed dinners will really help a lot, especially if they're more healthy. And just maybe expanding the food court to have more options, because I know a lot more upperclassmen aren't going to Crossroads and they're going to the dining hall. The food court. So just expanding that.
Right.
Yeah, I definitely agree with Ms. Johnson where she said it's not necessarily the campus's problem.
Right.
I just now noticed that on the Mox Dining website, you can build a meal and they'll show you exactly everything that's in that meal. It's down to the macros. They get very specific. And my first thought was why didn't I know about this?
Right.
And I just think that that's the main part. It's not the campus that's doing anything wrong. They could probably be doing a little bit more, maybe taking a little feedback. But it's just important that students are taking their health into their own hands. This is the first time as 18 and 19-year-olds that they're away from their parents and that it is in their own hands, which is why a lot of people go crazy, with the ice cream machine and everything. But I think it's important that students know that they have options available to them. They have free intramurals. They have free gyms. They have healthy options in Crossroads, and there's many clubs and things on campus. There's the Scrappy's Market, and so all these things are important. And honestly, at the end of the day, if a student wants to improve their health, they're going to. It just has to be a decision
Absolutely.
that they
Just
make.
them taking the initiative.
Oh, yes.
All right, guys. Well, there you have it. Thanks for listening to us talk and getting all the information that you need. Again, this is for our Public Health Essentials class, and so just thank you for listening in with us.